Hey guys. Okay, so I'm gonna talk to you guys, all you brand new CNAs, all your I've been an aide for a while thing, whatever. I'm gonna explain to you guys that you can sit here on YouTube all day, watch YouTube videos about being a CNA and my experiences of being a CNA, whatever. And you're gonna hear the same kind of stuff of I hate my job, I hate my life, blah blah blah, X number of reasons. Okay. If you're thinking about being a CNA, if you're thinking about going into that type of field, do it. It's one of the best things you will ever learn in your entire life. And you know what? If you get into it and you realize 6 months in that this really is not your job, your field, whatever, that's fine. Find a different job, use it to get you through in school, do what you have to. Keep your certification up to date. Because if something happens, worst case, you can fall back on being an aide. I personally work in in the ICU here at a level 2 trauma center, which is higher than an emergency room, but lower than a level 1 trauma center. We handle quite a bit of pretty crazy stuff. If you get flown out of here, off to like Mayo in Rochester, Minnesota, we send some people out there. You need some more important care that we can't do here. But being said, I've worked in nursing homes, swing bed facilities, Alzheimer dementia facilities, things like that, skilled rehab for about 4 years before I started at a hospital. Yes, it sucked, but it wasn't always that bad. You can't say that an entire profession is the worst job ever just because you have a bad experience with a nursing home or with a nurse or with a management system, whatever. Those were some of the best years of my life. Some of the hardest, most stressful years, yes, but some of the best. I think that any CNA that is starting out needs to start in a nursing home or skilled nursing home type facility because it helps you get your baseline skill set down pat. You learn how to give a good bed bath. You learn how to transfer people. You learn how to do a bed change with someone in there. You get accustomed to dealing with some of the most nasty bodily fluids you will ever deal with in your life. You learn teamwork because you have to work with other aides and with other nurses. You learn what to look for and what is more important. You learn how to thicken stuff if people are having swallowing difficulties, which that is a very, very big thing, especially in nursing homes. You learn how to be a people person. Even if you're only a people person for 8 hours of your shift, you need to learn to be a people person. You're going to have family or patients or residents that make you feel like you have no idea what you're doing. You need to learn how to cope with that. You learn how to cope with the loss of a resident that you get very close to. I know they say you can't pick favorites and blah, 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 whatever, but it happens. Don't let anyone tell you it doesn't happen because it does. It's a good place to start. And you know what? You probably will hate it for a little while. It's boring, it's repetitive, it's ridiculous sometimes. And that 12th time you do a bed change on somebody because their brief leaked or they puked everywhere and they're sick, you learn to not go in that room and be agitated at that person because in ultimate reality, they can't help it. You learn how to go in there, deal with it, help them, make them not feel like a horrible person because they're losing control of their bodily functions. And you can be agitated when you come out of that room. That's fine. Don't be agitated at that person. And working in that type of facility, it will teach you that stuff. You learn how to joke around. You get accustomed to the nursing humor. It's a good starting point. go from there and move up, or go into home health, or go into hospice. A really good friend of mine I work with now, she used to work hospice for years and she loved it. You can go into working with disabled people. You can work at a vet's home. You can do so many different things with a CNA license. It's ridiculous. But the thing I think most people need to do, and speaking with experience, I hate working with nurses that have never been an aide before, because 9 out of 10 times it takes things way longer than what it should ever have taken in your life. But keep your CNA certification. Don't let anyone tell you that it's ridiculous and they hate their job and you shouldn't go into it, which I see a lot and it makes me mad. I don't think anyone should ever say that to you, because you are your own person. You have your own experiences. Just because someone else hates their life does not mean you're going to. I'm hopefully going to be doing quite a few more videos. I have some other ones planned. I'm going to get my friend Holly. She works with me up at the hospital, but she worked as a hospice aide for a long time. I'm going to get her in here, talk to you guys about that stuff, and we'll go from there. If you guys have any questions, comments, whatever, video requests, put them down below. I'll get to them. Otherwise, have fun, be a great CNA, do life.